first case of California. Earlier today, another case was announced in Minnesota, including the first case of and just moments ago, Colorado Department of Public Health and Environment confirmed the first Colorado case of the Omicron variant. It is somebody who just traveled to southern Africa and returned. She is experiencing mild symptoms and is isolating at home. She was vaccinated but had not been boosted. And it has been confirmed that that is the first instance of the Omicron variant in Colorado. And I want to thank the team that found this, Dr. Herlihy, her team of epidemiologists, the Colorado State Lab, Dr. Emily Travanti. And the lead on this has been Tri-County Health and Dr. John Douglas. So thank you for your work, the contract tracing, making sure the person is isolating, and of course confirming this case of Omicron variant early. Again, this particular case is not community transmission in Colorado. It is a returning traveler from southern Africa. We don't yet know the extent of community transmission within the United States. We know if community transmission is occurring within Colorado, it is very small. How do we know that? We are now analyzing about wastewater. We do the wastewater analysis, and it has not yet shown up in our wastewater analysis. We also screen roughly 15% of all of the tests done in Colorado for COVID are also sequenced for Omicron and other variants. So if it was prevalent, we would know. It doesn't mean it's non-existent, but this is the first confirmed case, and it is a return traveler. So far, there's a lot of questions, of course, about Omicron variant. We expect that in the next week or two or three, we'll find a lot of answers. What makes the biggest difference for us here in Colorado and across the country is, number one, is it more transmissible? Number two, is it as virulent? Does it cause as severe health impact? Is it more virulent, very virulent, less virulent, just as virulent? And three, how well do the vaccines and immunity hold up to the new variant? Those are the three variables. At this point, I'm not terribly alarmed. There's indirect evidence that it's more transmissible. Why? Because it seems to be crowding out other variants in areas that it's prevalent. There is possible evidence that it's slightly less virulent, but it could be as virulent or slightly more virulent. But it's clearly not much more virulent, and we can be hopeful that it's less virulent, but it could be the same degree of virulence. And finally, there's indirect evidence. Again, we don't have direct evidence. We hope through the next weeks or two that vaccines are still effective at preventing bad health outcomes from the Omicron variant. We hope that that can be confirmed in the next few weeks, but at this point, it appears so far that the vaccine can protect against the most severe health outcomes, just as it does for the other variants. These are all the questions, right? These are questions. How much more contagious is it? How well do vaccines hold up? And how does it impact your health? How virulent is it? And it won't be long before we have those answers. I expect that it'll be a matter of weeks, not months, till we have initial data that's meaningful on all of those pieces of the puzzle. You know, when the pandemic began nearly 2 years ago, no one knew exactly what this virus would bring. The Delta variant wave, just as we thought we had turned the tide in Colorado, and now we're facing a new challenge. But that's why we need to double down on what we know works, and that means getting vaccinated. And if you're eligible, please get boosted. I got the booster, my parents did, our family did. If it's been 6 months since you got the Pfizer or Moderna vaccine, or it's been 2 months since you got the Johnson & Johnson vaccine, please get that third dose today. Scientists didn't know that it was necessary at the time, but it turns out it is. The immunity fades rapidly around the 6-month time frame and continues to fade unless you get that third dose. And with the prevalence of the virus today, the Delta variant, and potentially moving forward the Omicron variant, it's important that Coloradans take the practical, common sense step to protect themselves. We are also leading the way in Colorado in vaccinations for 5 to 11-year-olds. We don't yet know the impact of the Omicron variant on children's health as well, but we are 8th in the country among the states for the highest vaccination rate for 5 to 11-year-olds. We're at about 22%. We know we need to do even better. We will do even better. Update of where we are, 1,400 people hospitalized from COVID in Colorado today. That's 32 fewer than yesterday. And to really highlight the positive impact that vaccines are having, Of the 1,400 people that are hospitalized from COVID right now, 1,152 are unvaccinated, which is sad. That's 82% of the hospitalizations are unvaccinated. We've tried every way we can to show people mathematically, psychologically, the great benefit of the vaccine. Some people have not yet heeded that advice. If you're out there and you haven't yet gotten vaccinated, I encourage you to do so. Get that first dose of Pfizer, Moderna, get the second one 3 or 4 weeks later. And you will have a very high level of protection. We see relatively few people who are fully vaccinated being hospitalized. 248 people who are fully vaccinated are hospitalized. Many of those have not been boosted and were eligible for boosting. But to put things in perspective, that 1,152 people who are hospitalized who are unvaccinated, they come from the roughly 20% of the adult population that isn't vaccinated. Then from the much larger 80% of the population, we only have 248 people vaccinated. So that is even beyond those numbers where we show the great difference between vaccinated and unvaccinated protection levels. Keep in mind that there are many more vaccinated people, and the fact that there are many fewer hospitalized vaccinated people only shows even more how highly effective these vaccines are. We're thrilled and hopeful that there is a flattening to a downward trend in cases and hospitalizations. It's what we're seeing now. That's obviously before any effect from Thanksgiving or travel and family gatherings. If you have traveled over Thanksgiving, we encourage you to get tested several days or a week after you return to make sure you didn't bring back an unwanted gift from your travels across the country or across the world. I know that many families are looking for, you're ready to get vaccinated, you're ready to get the booster, you're ready to get your 5 to 11-year-olds vaccinated. I just want to highlight a number of those opportunities across Colorado. We are, first of all, Ball Arena is going to offer boosters and kids vaccines at many of their events, at their family ice skating shows, Avs games, Mammoth games. If you're going to any of those games, you can pick up your booster and get your kids vaccinated right on the spot. We also have several large-scale vaccination sites. Appointments are not needed. Chapel Hills Mall in Colorado Springs, Douglas County Fairgrounds in Castle Rock, Pueblo Mall in Pueblo, Arapahoe Community College in Littleton, and Aurora Municipal Center has a drive-through vaccination site, 15151 East Alameda. In addition, we are continuing to make the mobile vaccination stations available across the state. We're going to be at Cortez Public Library, Fort Garland Museum and Cultural Center, Lake County Public Library is all tomorrow, Pueblo Zoo, Trinidad History Museum Saturday, Boulder Community Health, Breckenridge Recreation Center, WOW Children's Museum in Lafayette in a few days. And we'll continue to reach out at sites across the country. You can check out covid19.colorado.gov and click on vaccines. Most of the vaccine sites offering vaccines for 5 to 11-year-olds. The parents can get the booster at the same time. It's very convenient. It's very easy. There are also, President Biden announced early today, they are working to expand pharmacy availability of the vaccines as well. Many people get them in pharmacies, but what I checked earlier, and some of them are like a week out or 10 days out before they have availability. Some pharmacies are offering walk-ins, but we hope that our pharmacy partners will continue to expand appointment availability as well. But we know that our pharmacy system alone can't meet the demand, and that's why we want to make it easy and convenient with all of these sites. If you're not much of a web user and you want your booster to get your 5 to 11-year-old vaccinated, call 877-268-2926. Once again, 877-268-2926. That's the number you call. Just say, I live in Conifer and I want to get a booster and I want my 6-year-old to get their shot, and they will help connect you with the provider in your area. Also, we know that masks, when you wear masks around others indoors, it continues to reduce the transmission rate. Not nearly as much as getting vaccinated. Wearing a mask is not an excuse not to get vaccinated. Please get protected. And of course, continue to use the free and easy testing services available across the entire state. You can also find those testing sites at covid19.colorado.gov. Click on testing. There's a reason beyond, of course, the knowing whether you have it and knowing whether it's contagious for your friends. The reason to get tested is when you catch it early, we have monoclonal antibody treatment available, which decreases your risk of hospitalization by 70%. And you can also find out where you can get monoclonal antibody treatment at sites across Colorado at our COVID hotline at 877-268-2926 or covid19.colorado.gov/monoclonal. It's a good reason to get diagnosed early. It's available if you test positive in the first week or so after you have it, if you're experiencing mild or moderate symptoms. And particularly if you're over 65 or if you are under 65 and have some pre-existing conditions, you're an excellent candidate for monoclonal antibody treatment, and it can have a demonstrably positive impact on the outcome for yourself, and I encourage you to get it. It is widely available in centers across our state and usually only takes a few hours of your time to get that. Look, the vaccine allows us to live our lives as normally as possible, and many Coloradans still think of the pandemic as a thing of the past. Unfortunately, we still have 1,400 of our fellow Coloradans in the hospital and are still experiencing pandemic levels of infection among the unvaccinated, with over 1,100 people hospitalized who are unvaccinated. I'm going to turn it over to Dr. Rachel Herlihy to discuss the Omicron variant.
Thank you, Governor. Good afternoon. So today I would like to first provide you with some additional details about the case of the Omicron variant that has been identified here in Colorado, and then talk a little bit about surveillance for the Omicron variant and COVID-19 here in the state, and talk a little bit about what we've been doing here in Colorado to respond. So as the governor mentioned, the case is an adult female resident of Arapahoe County who recently traveled to Southern Africa for tourism. She was fully vaccinated. She was eligible but had not yet received her booster dose. She has been experiencing mild illness and is isolating at home. This case consistently followed public health recommendations, including the use of a mask during travel. We are certainly grateful to her and to all Coloradans that continue to follow public health recommendations, including mask use. And at this point, we have no reason to believe that masks would be less effective for the Omicron variant than they are for COVID-19 in general. Close contacts of this case have tested negative. This person was identified following a positive test result through routine case investigation by Tri-County Health Department. CDPHE's epidemiologist flagged this case for follow-up because of recent travel history. CDPHE sent a team to collect an additional specimen for genome sequencing from this patient and has been working closely with Tri-County Health Department to investigate the case. Testing at CDPHE found the signature S-drop profile on PCR, which has been seen with the Omicron variant, but also other strains of COVID-19. Whole genome sequencing was completed late this morning and identified the Omicron variant. I want to turn to my slides now. So this first slide shows you the distribution of Omicron variant cases that have occurred so far across the globe. This figure comes from the New York Times and shows you that there have been now cases identified in the U.S. This is from yesterday. The case in California was identified. As the governor mentioned, there's now an additional case in Minnesota. Canada is our closest neighbor with identified cases as well. Cases throughout multiple countries in Europe as well. This map does show you the difference between countries where cases have been identified through travel and where cases have been identified with local transmission. As the governor mentioned, the case reported today from Minnesota did indicate that there was travel to New York, but not out of state, so that could potentially be a case that was acquired here in the U.S. Next slide, please. All right, so far what we've seen globally with the Omicron variant is a rapid increase in South Africa, especially in the Gauteng province. That is a province of South Africa where Johannesburg and Pretoria are, so it's the most populated province. This figure on the right is showing you the epidemic curve, or count of cases over time in South Africa by province. And so what you will notice is that really rapid increase in the red line. That red line is showing you the cases in Gauteng province, and there's been a really rapid increase in the number of cases seen there. That is one potential indicator to us that this variant could be particularly transmissible and more easily spread from person to person if we are seeing this rapid increase in cases. But really, most of the information we have about this variant right now is really coming from our knowledge of the mutations that are present in the genome of this variant. And some of those, as the governor indicated, indicate that there could be increased transmissibility associated with this variant, also potentially immune system evasion. So we're really at this point really trying to understand more about those mutations and trying to have on-the-ground observations about what immunity and transmissibility is looking like in South Africa. Vaccination remains critically important. WHO has expressed that they expect vaccines to remain effective against serious illness and death. There are many remaining questions, especially around the spectrum of illness. So we don't know at this point if illness is less severe, more severe, or the same severity as we're seeing with the Delta variant. So that's one of the critical remaining questions. You may have heard in the media about some reports of mild illness coming from clinicians in South Africa. WHO has urged caution in interpreting that data. A lot of those early reports have come from individuals that are younger, in their 20s and 30s, and so we're really waiting to have more robust data from South Africa to really try and understand the full spectrum of severity of illness. Next slide, please. So Colorado's response to the Omicron variant, we are continuing to do the routine diagnostic testing that we have been doing here. And again, we encourage anyone with symptoms or an exposure to be tested for COVID-19. International travelers or others who believe that they may have potentially been exposed to an individual with the Omicron variant, we are recommending PCR testing specifically. So we prefer that over the antigen testing. And that's because with the PCR testing, we can go on to do the whole genome sequencing work. So we recommend that PCR testing 3 to 5 days after returning from that travel, and we recommend that regardless of symptoms or vaccination history at this time. We are also, as the governor mentioned, pursuing wastewater sequencing in the state. So that is an added surveillance tool that we have to really try and understand if we are seeing transmission of the Omicron variant in the state, and transmission that is occurring undetected by case investigation, by clinical testing. As the governor also mentioned, we continue to do robust whole genome sequencing at our state lab. Our commercial labs across the country and here in Colorado also are performing extensive whole genome sequencing, which is the definitive or confirmatory test for the Omicron variant. We are working closely with CDC to develop protocols for traveler monitoring. We know that there is potential risk of continued importation of cases from countries where we are seeing widespread transmission, so working on that with our local public health partners in CDC. And then, as we did with this case, enhanced case investigation and contact tracing to make sure we have the ability to identify cases as they occur here in the state based on travel history, exposure history, and making sure that we identify those contacts to cases. Thank you.
So we're happy to take some questions.
So we know hospitalizations have fallen over the past week or so, but they're still not in the best shape. How do you guys prepare hospitals around the state if the Omicron variant is a lot more transmissible than what we've seen?
So our hospital situation, about 1,400 people are in the hospital for COVID right now, which leaves our hospitals at a very high level of occupancy. They're accustomed to being more in the 80% range. They're now in the 90% plus range. There is capacity. If you need care, you will get it. But it is very challenging at these levels. That's why during the surge, we began the process of expanding our hospital capacity by about 500 beds. A combination of step-down beds and reactivation of additional beds with staffing. So those plans continue just to make sure we're ready, regardless of whether it's the Delta variant or Omicron variant, if there's another increase in hospitalizations.
I'm sorry, I want to switch Spanish. I'm sorry.
Yeah, go ahead.
¿Nos podría repetir lo mismo que mencionó al principio sobre el nuevo caso que salió aquí en Colorado, pero para tenerlo en español?
Sí, identificamos el nuevo tipo de COVID-19 aquí en Colorado, se llama Omicron variant de COVID-19, pero todavía los doctores no saben mucho sobre este tipo de virus. Queremos tener información sobre qué es más peligroso o qué es diferente sobre esto. Todavía creemos que, y todos los doctores creen que el vacuno todavía es muy efectivo para asegurar su salud.
Dr. Herlihy, can you answer a few more questions about the variant case, specifically when the woman traveled through DIA, when they started getting sick, when they first tested positive, and maybe what country they actually traveled to?
Yes, so this individual traveled to multiple countries in southern Africa. She returned to Colorado late last week, traveled through DIA. Sorry, what were your other questions?
When she actually first tested positive.
Oh, she tested positive a day after she arrived. So several days ago, she tested positive, which was around the same time she developed symptoms. So she was not symptomatic when she returned to Colorado.
Hi, Governor Dave Perry with Sentinel, Colorado. My question is about the at-home testing kits offered by the state. And I was wondering, does the state know how many have been sent out, how many have been used? Is there any indication that widespread at-home testing could be affecting the positivity rate in the state, gleaned from statewide test reporting? And then also, I wonder if there's any information from Dr. Herlihy about the rate of COVID infection or hospitalization by people in Colorado who've received booster vaccines.
So, Dave, we offer them as a convenience to Coloradans. We get them to you now. The turnaround is really 3 to 5 days. If you'd like a free testing kit, you can go to covid19.colorado.gov. We offer up to 2 a month for individuals who want to test. Most of those are not reported. They're a convenience for people. We hope and we encourage people to report. We tell them how to report. They probably report some of the positives. We sure hope they do to their local health department. But this is a testing above and beyond what is available through the PCR testing. A lot of folks simply want to screen, a family before Thanksgiving. It's an easy way to do it. It's a great value to people. I've heard so many great stories of people who've used them and just confirmed that everybody was negative, or perhaps they found somebody that was positive and asymptomatic and made sure that others weren't exposed. But we don't have, nor did we expect that most of those, the usage of them would be reported back. But we do consider the program a success for both the peace of mind that it's been giving to so many Coloradans who benefit from this, because they're hard to find at local pharmacies, but also the overall epidemiological benefit of simply having more testing out there. Even when the state is not notified of the negative testing results, to have that out there is a very important step. Dr. Herlihy, do you want to address that one as well as the other one he addressed to you? Would be great.
So percent positivity, I think it's a good question. We know that there have been lots of changes in patterns of testing, and that certainly could affect the data. I think what is important to note is that we believe that looking at the percent positivity data over the short term is still a really effective strategy. So as those numbers move along with case numbers, we think it is really realistic to try and interpret changes in transmission over the short term. So over the last 6 months or so, we believe that those values are appropriate to compare from 1 week to the next. Can you remind me of the second question then?
I was wondering if there's any information related to the rate of COVID infection or hospitalizations by people in Colorado who have gotten their booster vaccines.
Our team is actively collecting that data. One of the challenges that we are having is that the numbers are still quite small, and so the estimates are not stable. That's obviously a good problem to have, meaning that we are not seeing a large number of cases, hospitalizations, especially occurring among individuals who have received booster doses. We know that CDC is analyzing the same data to try and answer this question, and they are probably going to be a better source of early information because they obviously have access to much larger data sets than we would here in Colorado.
Thanks.
Dr. Herlihy and maybe Governor, I wonder if you can kind of talk about the broader COVID situation in Colorado. We're seeing hospitalizations decrease. Do you guys feel like we're on a downward trend even as this new variant?
Yeah, it's hard to say. Certainly, we're less worried about exceeding our hospital capacity than we were 2 weeks ago. But when this virus throws spitball after screwball, and so who knows where we'll be 2 weeks from now, especially after the holiday gatherings. But certainly, I think we have a better degree of confidence now that that we have the hospital capacity that we need, especially with the buffer that we're working on bringing online. And look, Coloradans, they're gonna acquire degrees of immunity to this virus one way or the other, and the better way to get immunity is to get vaccinated. If you don't get vaccinated, you're probably going to encounter this virus, and you could get very ill, and you could be hospitalized, and you might not make it. That's why 82% of the people hospitalized right now are unvaccinated. And that isn't going to change. And of course, after you've had an infection, you have a degree of natural immunity. You can augment that by getting vaccinated. Hybrid immunity has been shown in several studies to be an even higher level of immunity than the vaccine or prior infection alone.
Question about the state's at-home testing program.
Yes.
Now that the Biden administration announced that it'll be covered by insurance, what does that mean for our program, and will people still be getting it for free?
Yeah, and also this kind of goes to Dave's question and yours. What we're happy to get both of you is we have the numbers on the utilization of that. Dave, we have the numbers I think you asked. I don't have them in front of me, but we will get you sort of how many go out. It is we're happy with it in the sense that demand and supply are roughly in sync. They're not gathering on shelves and they're not backlogged, so we're happy with that. There are many other ways to get tests. Tests are free. If you're experiencing symptoms, I want to be clear, you do not order this and wait 5 days and test yourself. You go down and you get tested at a free testing site that day. This is more to have on hand for screening, for regular testing, for group gatherings. That's the kind of use case for this. If you're sick, get tested right away. But if you want that peace of mind, you can certainly order these tests and use them before large gatherings or weekly if you're in a high exposure environment. But we'll get you the exact numbers that have gone out.
Governor Polis, hi, Sarah Flower with KSUT, Four Corners Public Radio. Does the news of this variant change your mindset on doing a statewide mask mandate rather than leaving it to local public health departments?
No, this was expected news that any variant that is so prevalent in the world as the Omicron variant is. We knew it wasn't a matter of if, it was a matter of when it was identified in Colorado. We have travelers that return from Southern Africa. We don't yet have substantial community transmission of the virus. It's possible we don't have any community transmission of the Omicron variant, but if we do, it's a very small level because we would pick it up in wastewater and the 16% of tests that we sequence routinely and would have identified that. But I think it's a reminder for people about the importance of getting vaccinated. And like everybody else, we're looking forward to what information that scientists can put out in quality studies about the Omicron variant and its impact on virulence, on how contagious it is, and on vaccine efficacy in the coming weeks.
Hi, Governor Seth from the Gazette. Two questions. One, I'm sorry, I totally lost my train of thought. One, is there an explanation or theory about why we're seeing a downturn in hospitalizations now, kind of consistently over the past week plus? And this is probably for Dr. Herlihy, is there any reason to step up surveillance, or do you feel that the current detection system is still adequate? Thanks.
So this virus goes in waves. It has in Colorado, it has across the world. It increases for a period of time and then it decreases. That could be a result of several aspects. It can be a result of increased natural immunity that occurs from infection. It could be a result of changes in behavior that occur when people are aware that there's a high virus transmission level in a community. But the type of pattern and curves that we've seen in Colorado are not terribly different from those that have occurred in other states and countries. And I'll turn it over to Dr. Herlihy for the other question.
Thank you. So we are certainly confident in our laboratory systems in the state. So as we reported on earlier this week, Colorado actually has one of the highest rates of whole genome sequencing in the country. So we're certainly very proud of that. But of course, testing relies on individuals choosing to go get tested. And so we certainly at this time want to make sure that individuals who should be tested, those that have had exposures or those that are symptomatic, are seeking testing, especially those have returned from international travel. So again, asking the public to, be tested, make sure that you are seeking testing when testing is recommended, because that's obviously a fundamental part of our systems.
Hello, this is Meg Wingeter from the Denver Post. My question is more for Dr. Herlihy. You said about that we don't really have any evidence of widespread community transmission, maybe not any community transmission. So if that ever develops, is the wastewater going to be the first signal on that? And for an average person, does it make any difference whether there's widespread Omicron transmission versus widespread Delta transmission?
So I would say both our laboratory-based surveillance system as well as our wastewater system, both are going to be important indicators for us if we are seeing widespread transmission in the community. I think those are really both great ways for us to identify the level of transmission that's occurring. Can you repeat your second question, please?
Oh, just if it makes any difference to the average person and what they should be doing if there's widespread Delta versus widespread Omicron at some point.
Yeah, so the strategies are the same. So getting tested, wearing a mask, certainly getting vaccinated, all of those things that we've been doing, physical distancing, washing your hands, all of those same strategies remain the same. I think at this point, we really still have lots of questions about the severity and transmissibility of Omicron versus Delta. So more to come on that as we learn more from particularly South Africa over the next couple of weeks.
Thank you.
Go ahead.
Hi, Governor. Sorry about that. This is Rafael with Univision. Ante la presencia de la nueva variante de COVID-19 en el estado, ¿cuál es su plan para contener la propagación del virus?
Como los otros variantes, la cosa más importante es para recibir el vacuno. Es muy efectivo, es seguro y es muy importante para proteger su salud. Y también, después de 6 meses de sus dosis iniciales, es importante recibir el tercero dosa. Yeah, I'm proud of Colorado and the state lab for being the third state to identify this. That doesn't mean that Colorado's the third state that has it. There could be 25 states, there could be all 50 states that have the Omicron variant, but we have very good screening and detection in Colorado. As we indicated, we're screening about 16% of all tests done in our state for the Omicron variant. That's how we can conclude it's not widespread. It has not yet showed up in the wastewater data. If it does or when it does, we'll know that it's more prevalent in our state. And I want to make sure that Coloradans know that this current case is directly linked to travel in southern Africa. And we're all looking forward to the information that will come out of the science being done in South Africa and other locations about the unique attributes of this particular variant. In the meantime, let's not waste time. If we have a few weeks or longer until this variant or other more contagious variants are widespread here, let's use it wisely to protect ourselves. Get your 5 to 11-year-old vaccinated and get your third dose. Get your booster if it's been 6 months since your first 2. Thank you, everybody, and happy holidays.